If you suffer from pain, the chances that a doctor prescribes you an opioid depends, at least in part, on where you live. Take a look at this map. A new study by the Centers for Disease Control and Prevention found higher opioid prescription rates in areas with high unemployment and small towns. The CDC also found that prescribing practices are so inconsistent, residents in some counties are prescribed 6 times more opioid painkillers than those in other counties.
The level of prescribing in 2015 was enough for every American to be on opioid medications round the clock for 3 weeks. That's just too much.
In 2010, the amount of opioids prescribed in the U.S. peaked at a figure equivalent to 782 milligrams of morphine per person. By 2015, that figure had actually dropped to 640, but that's still 3 times as high as it was in 1999. That concerns policymakers as they try to curb an epidemic of opioid abuse that led to more than 33,000 deaths in 2015. Some states are taking action to catch people who are abusing opioids. A new Georgia law requires pharmacists to report all controlled substance prescriptions they fill to a monitoring database within 24 hours.
The Georgia pharmacists, I think the consensus overwhelmingly was, the scope and the depth of the opioid epidemic really compels this, and so it's absolutely worth it. And we believe that it will save lives.
Yeah, federal health officials are urging doctors to explore other pain management options such as physical therapy.